Expected ruling by the U.S. Supreme Court on the Affordable Care Act, commonly called Obamacare, could have a major impact on thousands of folks here in Connecticut.
That ruling could impact both people with and without health care insurance in big ways. Our chief political correspondent Mark Davis is live now with a breakdown. Mark?
Hi, Darren and Sonia. Good evening, everyone from the Hartford newsroom. First of all, senior citizens could lose that big break they've been getting on prescription drug coverage. But young or old, if the High Court rules this unconstitutional, a lot of stuff people like could be in jeopardy.
How about here? Just a little.
They see about 15,000 people a year here at the Community Health Center in Middletown. About 1 in 4 is uninsured. If the Supreme Court throws out the Affordability Care Act, commonly called Obamacare, they expect that number to go up dramatically because many small businesses will lose the federal tax credits that help them pay to cover their employees.
Without that, there will be more workers who will lose their health insurance and will be uncovered in Connecticut.
And for thousands of other Connecticut residents, several mandated benefits on their health insurance policies could be eliminated. State Controller Kevin Lembo was the state health care advocate for 6 years and helped write part of the law with Senator Chris Dodd.
The age 26, for example, that allows parents to keep their kids on the plan, that goes.
Plus the part of the law that requires your insurance company to cover annual physicals and other preventive care with no copays.
The ability for folks to get coverage, even if they have a pre-existing condition, goes. A lot of very important pieces will disappear if the whole law is thrown out.
If you want a framework, it's $100 million, it's 500,000 people, it's big.
For the state government, it would create an enormous hole in the budget because the state is expecting to move thousands of low-income people onto Medicaid with a promise from the feds for $100 million to do it.
There's about 500,000 people in the state of Connecticut that if this plan fails, will not have the kind of coverage at the optimal price that they would otherwise have.
Now, the court could just selectively rule out part of the law, and that is the so-called mandate that everyone have health insurance. But if that goes, all of those mandates, all of those coverage mandates could be in serious jeopardy. One theory has the court not doing anything, saying that it's not legally ripe for their review yet, and that means that no one has actually been affected by the full implementation of the law and that they should wait a couple of years before the High Court rules on it. In any event, the ruling is expected at about 10 a.m. tomorrow morning, and ABC and News 8 will have live coverage from Washington. Live from the Hartford newsroom, Mark Davis, News 8.